My name is Kyle Morin, and today I'm presenting my project of screening anti-seizure drugs on Dravet syndrome patient-derived brain organoid models. Dravet syndrome is a rare developmental epileptic disorder which can cause cognitive and behavioral decline during neurodevelopment. It is believed that 1 in 20,000 to 1 in 40,000 individuals worldwide are affected by Dravet syndrome. Epilepsy is caused by uncontrolled bursts of electrical activity within the brain. Due to the epileptic nature of Dravet syndrome, anti-seizure medications try to reduce excess electrical activity. Unfortunately, drug-resistant seizures are a hallmark of Dravet syndrome, which significantly increases the risk of sudden unexpected death in epilepsy and developmental disturbances. Polypharmacy, or the use of multiple drugs, has become increasingly common in the treatment of Dravet syndrome as single anti-seizure medications have generally been inadequate. First-line therapies commonly include VPA or valproic acid and CLB or clobazam, with an additional adjunct if these two prove ineffective. Zonismide is a relatively new anti-seizure medication which has been approved for broad use in Japan, but only approved in the US as an adjunctive therapy for specific cases. Recent data has highlighted zonismide as an anti-seizure medication of interest in the treatment of Dravet syndrome, as it was seen to provide additional support to other, more common anti-seizure medications. And due to the complexity of the human brain and disparity between species, it is difficult to study brain disorders in animal models. In this study, blood samples were collected from a patient with Dravet syndrome. Cells were obtained from their blood and were reprogrammed to develop a cortical brain organoid, otherwise known as a miniature brain. This miniature brain is extremely useful as it contains the same genes as the patient and therefore allows us to model the patient more accurately. As seen in the image, the model contained functional similarity to the brain, with mature neurons seen in red and DNA in blue, indicating effective neuronal activity. Here we can also see an organoid at 10 days old, and although it looks small, these things did make me come in on the weekends to feed them. And this is Lyndon and her family. Lyndon has Dravet syndrome and has drug-resistant seizures which impact her daily life. They graciously donated their blood, which was used to create the model for this project, and so I kindly thank Lyndon and her family for allowing us to use their cells to better understand Dravet syndrome treatment. So Linden cells, otherwise known as human-induced pluripotent stem cells, were reprogrammed to form cortical organoids, and at 3 months of age, the organoids were incubated for 16 hours in a combination of anti-seizure medication combinations. Following the incubation, organoids underwent a metabolic screen to capture oxygen consumption rates as a proxy for neuronal activity. This is because neurons possess a high concentration of mitochondria, as the brain is highly dependent on the energy produced by that mitochondria. We also conducted a live calcium imaging test to detect neuronal activity. Here we used a dye that allowed us to detect the movement of calcium ions into neurons, which we could use to quantify electrical activity. And so my research question was, is there an effective combination of anti-seizure medications for treatment-resistant Dravet syndrome patients? And I hypothesized that there would be anti-seizure medication combinations that would restore decreased metabolic activity that was previously seen in Dravet syndrome rage organoids. So we started with a calcium activity test to detect changes in neuronal events. And here, live imaging allowed the detection of calcium movement and was used to detect neuronal activity. In this movie, we can see the different frequencies and amplitudes of calcium events in a healthy control organoid. And then as seen here, there was no change in frequency and some counterproductive increases in amplitude shown by the higher electrical activity, which is actually the opposite of what we want. And through this, we concluded that the common therapies with VPA and CLB were ineffective. We then looked at basal respiration, which refers to the oxygen consumption rate under normal or unstressed conditions. We tested several combinations and again found that VPA and CLB were ineffective. However, we did find 6 combinations of anti-seizure medications that restored basal respiration to levels in line with the healthy control, 5 of which contained a zonismide background. We then went on to test more zonismide combinations using other metabolic parameters, and we again found 4 out of 5 zonismide combinations that showed restoration of total mitochondrial respiration, which is basically a snapshot of all mitochondrial function. Therefore, there lies a need to test combinations of anti-seizure medications in a relevant Dravet syndrome model in hopes of finding suitable treatment. Our findings showed that commonly prescribed first-line therapies like VPA and CLB were ineffective. We also found that zonismide combinations restore metabolic activity, which suggests the improvement in neuronal activity in Dravet syndrome patient organoids, and therefore zonismide may act synergistically with other anti-seizure medications by possibly enhancing their effectiveness and reducing the seizure activity. There lies a need to further investigate zonismide in patients to determine its efficacy. Thank you.